It's called the silent epidemic.
Everybody's at risk. This disease does not discriminate.
I think the cost of not effectively addressing this issue will be unbearable.
1 in 3 people die with the disease over 65.
Number one risk for developing this disease process is age, right? So in this one, we're all together.
The disease is Alzheimer's and related dementias. By 2050, its global economic burden is projected to exceed a staggering $10 trillion. The impact in Florida is already profound and growing. Florida has the nation's highest percentage of adults 65 and older and accounts for 10% of all Alzheimer's cases in the U.S.
The state of Florida will be significantly impacted by this disease alone, not only the patients that are diagnosed with the disease, but the family unit surrounding that patient.
Public health officials are sounding the alarm. Investment in research is exploding, and companies like K2 Medical Research in Central Florida are working around the clock to inform and educate those in their community about major advancements in prevention and treatment. But there's a major problem. As individuals, we don't want to think about it, talk about it, or test for it.
They tell you straightforward, I don't want to know if there's something this serious waiting for me. I don't want to know, when it should be the opposite.
The only way that we're going to be able to find a cure is to talk about it. We have to make people comfortable talking about it.
I think that people feel like there is no hope, and the hope is there. We're seeing with multiple medications now that it either slows or reverses the progression.
We now know that the disease occurs 10 to 20 years, almost 2 decades before the onset of symptoms.
While there still is no cure, there is more hope than ever. The key to preventing or slowing its progression is early detection.
We have the potential to treat that disease early with the hopes of preventing symptoms from ever occurring.
Yes, there's multiple blood tests. Very simple blood test that gets done. You get the results back in like 3 weeks, and it actually shows a protein that's forming potentially 10 to 20 years prior to having symptoms.
The science is there, the treatments are there.
You just have to be bold enough to take the test and see your healthcare provider on a regular basis, and so I try to do that.
For the most part, these screening tests, medications, and treatments are only available in clinical trials, which today are safe and highly controlled with multiple levels of oversight.
The level of care that you get is exceptional.
It's like tomorrow's treatments today. We have access to what we'll be using clinically in 5 years or 10 years.
One of the reasons why I enrolled was because my father passed away from complications of Alzheimer's. And when I found out about the study, I said, let's find out if I might have any factors that could lead to having that myself.
Well, I started the infusion last month, and I'm on my second one now. And I feel much better, like my mind works a little better.
In clinical trials, we can give patients hope, and we can give them the opportunity to go on treatment that could have a life-changing impact on them and their family and their community.
This is the first clinical trial I've ever joined, and I've joined it very happily, and I'm very satisfied with it.
We understand that just the basic barriers to participation in clinical research are transportation, accessibility, and language and trust, right? So we knew that we had to do something to be able to reach our diverse communities.
K2 Medical Research solved that problem with a mobile unit that takes education and opportunity into every community it serves.
The purpose of our team and Wanda, the mobile unit, is to bring research, valuable research, to underserved communities, helping teach them about not just the different options, but also educate them on the disease.
I want every single ethnicity and race out there to be aware of their risk factors and also be proactive about their health.
We are sort of entering in a new area of clinical trials around Alzheimer's disease, where we're focusing on prevention, identifying patients who are healthy, they're asymptomatic, they're living their best life, but they're at risk because they're in that 10 to 20 year period where the pathology of the disease is there, but they have no signs and symptoms of the disease.
Together, Growing Bolder and K2 are working to create a community-wide conversation to share the good news that hope and help are available.
I have to applaud what you're doing and other organizations within our community to bring awareness to the situation.
I've gone through colon cancer, breast cancer, and I'm not afraid to talk about it because you're giving knowledge to the people that are afraid to do that.
There's help out there. That's the important thing. There's help out there.
It's critical that we all take an active role in participating in research so that we can find a cure, so that the generations that are coming behind us, that's one less thing that they have to worry about.
We can't do this alone as physicians and clinical researchers. We need everybody to step up and kind of make a difference and volunteer. So we need your help.
There's a lot of hope. The diagnosis doesn't define you.
This is not the end of your life. You can still sing and have dementia. You can still run and have dementia. You know, you can still enjoy your favorite meal and have dementia. Don't be afraid of the symptoms.
Join the conversation, ask questions, share your stories, your fears, and your hopes. Get tested, volunteer for clinical trials, and make the kind of daily lifestyle choices that support a healthy brain.
Anything that we can do to help reduce our risk, whether it's sleep, whether it's eating well, whether it's exercise, being social, drinking water, anything that we can do to reduce our risk is important.
This disease takes so much from families. I really think the time is now and the time is right for Central Florida as a community to come together and share those painful moments, share those fears, those uncertain moments, but also do what we do best, share the hope that we feel about the progress that we can make with this dreadful disease.